Hello everyone, I'm Jessie. So we are a group 2 and these are my group members. So we are going to talk about the 12 Mission Plan, Team 2, Strengthening Security, Wellbeing and Inclusivity. The game charges that we choose is revitalizing the healthcare system in ensuring a healthy and productive nation. The 12 Mission Plan is a development roadmap for 2021 to 2025 presented by our Prime Minister, Datuk Seri Ismail. So I'm going to introduce about the Team 2 of the 12 Nation Plan. In this plan, government will put efforts in nation building and create a conducive environment for economic activities, as well as a safe and harmonious living for the people. The COVID-19 pandemic has tested the strength and response of healthcare delivery system across the world. Thus, revitalizing the healthcare system is critical in order to ensure the people have equal access to healthcare service, as well as be well prepared in meeting the future health crisis. So about the game charges 5 under Team 2. So in improving the well-being of the people, more focus will be given to enhance healthcare service delivery through revitalizing of the healthcare system and greater collaboration in the consolidation of the resources. Firstly, healthcare service will be redesigned to ensure efficient and affordable healthcare delivery to the people. Measures will be focused on strengthening healthcare policies, combating communicable diseases and non-communicable diseases, as well as enhancing healthcare programs for older people. Secondly, measures will be taken under address the increasing cost in the provision of quality healthcare service. So the initiative will be introduced to ensure sustainable healthcare financing and strengthen healthcare protection coverage for targeted groups. Lastly, the healthcare subsector will leverage emerging technologies to reduce costs and unnecessary procedures. In this regard, more healthcare services will be digitized to ensure seamless utilization of information and solve the issue for fragmented health information system.
Hi Miss, my name is Somaisian and I will talk about the overview of Malaysian healthcare system. Since 1970 until now, Malaysia runs a two-tier healthcare system. Our healthcare system has been divided into a government-based universal healthcare system and a private healthcare system. The public sector caters about 65% of the population, while the private sector serves for the remaining 35%. Public sector healthcare system is subsidized by Malaysian citizens through general taxation of income. Hence, patients only need to pay the nominal fees in public healthcare system. Foreigners can also use public healthcare system as long as they pay for the additional fees. Private healthcare system has its own benefits as well. For example, they provide faster service as a result of more doctors in the sector attracted to higher salaries and also better working conditions. The figure shows a clear overview of Malaysian healthcare system. As we can see, the healthcare system has been categorized into public sector and private sector. For public healthcare system, the funding sources are from local taxes, government general revenue, SOCSO, and also EPF. On the other hand, private healthcare system is funded by the individuals themselves, the employers, the private insurers or group managed care schemes. From the perspective of consumers, public healthcare system focuses on a wide range of consumers. They provide universal coverage not only for urban population but also rural population. For private healthcare system, they provide services for those who can afford and can get access to the facilities.
I'm Tan Sin. I'm going to talk about allocation of budget to public healthcare facilities. Budget 2022 will provide 32.4 billion to the Ministry of Health for the operating and development expenditure. Firstly, an additional 4 billion will be provided specifically to continue the agenda on managing COVID-19, which include 2 billion to fund the vaccination program and 2 billion will be provided to enhance the capacity of public health service facilities, including the purchase of medicine, consumables, personal protective equipment, and have budget 2022-9 kits. Next, in order to provide the third dose of the COVID-19 vaccine as a booster shot to all adults alongside continuing the vaccination of children aged 12 to 17 years old, 6 billion will be provided to National COVID-19 Immunization Program. And the government has signed agreements to procure 88 million doses, which is equivalent to 140% of our population. Furthermore, to foster a culture of healthy living as well as addressing non-communicable diseases, the government will continue to drive the Agenda Nasional Malaysia Sehat program with 15 million. As for rare diseases, government will also strengthen the clinical management of patients with rare diseases with 20 million. In addition, to support a healthy lifestyle, the government proposes to expand the imposition of excise duty on sugar-sweetened beverages and plans to impose excise duty on liquid or gel products containing nicotine that are used for electronic cigarettes and vaping. Besides, to support the effectiveness of public health services, the government will work with the Malaysia Red Crescent Society and St. John Ambulance to improve access and responsiveness of ambulance services with 8 million. Apart from that, the government agrees to approve the sponsorship of medical specialist programs with an allocation of 100 million for the benefit of 3,000 medical and dental contract officers. Lastly, the government allocates 70 million to ensure that mental health issues are continuously given due priority, which includes mental health program, counseling, psychosocial support, and so on.
Hi Miss, my name is Lim Siu Ching. I will talk about the implementation plan to strengthen of healthy care system. The implementation plan to strengthen of healthy care system is to ensure all Malaysians has equal opportunity access to healthy care service. In strengthening public health, investment must be increased to support the public health initiative of the Ministry of Health. Public health priority areas that require attention include healthy protections, injury prevention, disease control, and responding to public health threats. In COVID-19 pandemics, disease control is very important. The MOH also built healthy care service that treat patients closer to home. This can solve the inadequate facilities and insufficient healthy care service resource. Government revitalization of the country healthy care system to enhance preparedness for future healthy crises. This can strengthen the infection prevention and control programs. Infection prevention and control is critical in nursing, protecting patients, and healthy care workers from the disease. Besides, healthy care system can protect healthy care workers and citizens. In COVID-19 situations, patients has access to high-quality healthy care and medical personnel can have safety working environments to provide service.
Hi Miss, my name is Sarah Liu Wen. I would like to present about the strengthening of healthcare and awareness. First, strengthening health protection. For example, government will strive to encourage people to have insurance and takaful in financing healthcare expenses, and expand the protection scheme under SOCSO for covered workers in the informal sector to enjoy health benefits. Second, strengthening healthcare programmes of older persons. As Malaysia moves toward an aged nation by 2030, the healthcare programmes for older persons must be improved. For example, to meet the needs of older persons, the design of private healthcare facility should comply with the Private Age Healthcare Facility and Service Act 2018 and Care Center Act 2018. Then, domiciliary healthcare will incorporate oral healthcare services to prevent and treat oral cancer among older persons. Last, enhance health literacy and awareness. A national health literacy policy will be introduced to public for improve the knowledge and understanding of basic health information and services needed. According Agenda Nasional Malaysia Sehat, healthcare awareness program will be intensified through various platforms at all levels. Then, the implementation of cost plan will be invigorated at workplace to reduce the number of non-communicable diseases cases.